Good afternoon, everyone, and welcome. Today is the Macular Degeneration Association's last program for 2025. We ask that you check our website, which is www.macularhope.org, starting in March for our new exciting 2026 program lineup. I would like to thank Regeneron, Apellis, Sun Pharma, eSight, Lumathera, MacuHealth, and Nodal Vision for their support of these programs. For those that do not know us, the Macular Degeneration Association is a 501c3 nonprofit. We do host these educational programs, either virtual or live in person. And our other mission is to support research, which if you've gotten the newsletter, you have gotten an update on our latest research. In 2007, the Macular Degeneration Association was formed by our chairman of the board, Lawrence Hofheimer. He was unfortunate to watch his mom lose her vision due to macular degeneration, although at that time it was called losing vision loss due to age. He vowed that he would start this organization to provide information about the latest research, treatments, and to provide hope and understanding to those that have this terrible disease. We do have a wonderful speaker today, Dr. Dr. Gerson. He is our medical director, and we are very proud to have him today. So I'm going to do the introduction for Dr. Gerson. Dr. Gerson graduated from the Indiana University School of Optometry in 1997, after which he went on to do a BA residency concentrating on low vision and ocular disease. He has been in several different practice settings, including a retina referral practice where he participated in several large clinical trials. Currently, Dr. Gerson is in private practice that is a collaboration of both ODs and MDs. He sees primary care patients and has an emphasis on retinal care in his practice. He enjoys having fourth-year optometry interns with him and the challenges that they present. He still participates in clinical trials and utilizes many different diagnostic modalities. Dr. Gerson is a frequent lecturer in the U.S. and abroad and writes regularly for optometric publications. When not at work, he enjoys traveling, working out, and spending time with his family. Today, Dr. Gerson will be talking about Ask the Expert. You'll be able to ask any question of him. This is an open forum, so please, when you're going to ask him any questions, at the bottom of your screen, you'll see a Q&A session. Please put it in there and not in the chat. The chat, unfortunately, will not be answered. At this time, I'd like to turn it over to Dr. Gerson.
Thanks, Donna. And really, thank you to everyone that tuned in today. As Donna said, this is really meant to be kind of an open mic session where really just open for questions. I really don't have any planned material for what to talk about today. I just wanted to leave it open to everybody's questions that you may have about macular degeneration or even really other eye care related topics, whatever you might have on your mind, haven't been able to ask, or maybe ask someone else and didn't get a satisfactory answer. I would just ask that because of the number of people we have on today, if you could start just getting the questions in as soon as possible to try to help make sure that we get to whatever question you have, because there may be a whole lot of questions, and I wouldn't want to not get to somebody's questions. So the only thing that I'll say to kind of start off is just that, Donna mentioned the website, so macularhope.org. And I assume if you're signed up for this, you've been to the MDA website. It is a great resource. There's a section where Donna is keeping things up to date on virtually a daily basis when there are new things in eye care in general, but especially macular degeneration specifically. They get posted like before I can even tell Donna about it. Every time I try to tell Donna about something new and, hey, we might want to post this, her reply is always, well, it's already there. So I guess shame on me for not checking there first, but just to make sure that you know that really whatever is new, the latest and greatest, it's virtually always on the website. So really take advantage of the website for the incredible, fantastic resource that it is, because it really is. It truly is a pretty unique website with what it offers, especially all of the stuff that Donna puts on there to keep all of us up to date. So again, this is kind of open for you to submit questions, and I would ask that you go into the Q&A section and start sending in questions so that we can answer whatever you have on your mind. The last thing I'll say before I start answering some of the questions that are already coming in is, there's been some really dramatic improvements, changes, and things going on in macular degeneration just over the last couple of years. Anything from new medications to reformulated medications to new forms of treatment for dry macular degeneration. There is a lot going on. And so, Donna mentioned Larry Hofheimer's mother, which was kind of the impetus for him to start this organization. And when she had macular degeneration, that there was really nothing that could be done. It was just kind of, well, here's your diagnosis and cross your fingers and hope that you don't lose all your central vision. And it's dramatically different today. And the outlook, if we were to look a year or 2 or 5 down the road, is really even better. And some of the stuff that's, becoming a reality, not quite yet a reality, but becoming reality, it almost sounds like science fiction because of how things work, how it's delivered to the eye, all sorts of things like that. So with that, I'm going to start jumping into these questions. So thank you for those of you, for all the people that are already submitting questions. For the rest of you, I would encourage you go ahead and try to get them in as soon as you can so that I can try to get to those. By knowing how many questions I have, it kind of lets me know how much time I have to spend on each one. And if we get a whole bunch of questions at the very last minute, then unfortunately, we're just not going to have enough time to answer them. So that's why I want to get as many of you sending your questions in as soon as possible. That would be great. All right. So I'll read off the questions. So somebody asked, has Eylea actually stopped progression of macular degeneration? So Eylea is the name of one of the medications that's used for wet macular degeneration. Interestingly, there's actually 2 versions of Eylea that are out. One is the original, and then the second one is called Eylea HD, where the HD essentially stands for higher dose. So it's 4 times the dose, 4 times the concentration of the original. And so I'll talk about it from that perspective. So with Eylea HD, what we know is that most people can go up to 12 weeks, and many people can go up to 16 weeks in between their injections. And so that's the major advancement with the new Eylea. It's not that it necessarily works better as far as vision and outcomes. It works better as far as how long you can go in between the injections. Has it stopped AMD? No. Does it reverse it? No. But it is a treatment that hopefully once people are on treatment and receiving regular treatment, that that in some cases it could dramatically slow, and it seem like it's stopping progression of macular degeneration. So it's not the only medication that's available. There's a number of them, but it's one of the newer ones that do a good job of not just of working, but working for a long enough period of time that you don't feel quite as burdened going in for your treatments. Good question. I really like that. So keep your questions coming. There's a question, is the AREDS vitamins the only vitamins I should take? What if I have wet macular? So AREDS vitamins are a specific type of vitamin that your doctor may prescribe for your macular degeneration. Usually it's if you have at least a certain level or severity stage of macular degeneration. So an AREDS 2 vitamin only has a pretty limited number of things in it, all at very high doses. So what's important to realize is that is very different than a multivitamin, for example. So a multivitamin has a little bit of a whole lot of different things, whereas an AREDS 2 vitamin has a whole lot of a very few things. So kind of flips the scale. So if you're on an AREDS2 vitamin, you should also be taking a multivitamin plus any other vitamins or supplements that any of your physicians may have told you. It's important when you go to the doctor's office and they ask you what medicines you take, include your vitamins, because it's important for us to know, whether it's your eye doctor or your other doctors, it's important to know what vitamins you're on, because that may affect our recommendations, or sometimes we can just help you kind of consolidate. So instead of taking vitamins from 5 bottles, what if it was only 3 bottles and you're still getting just as much good? Second part of that question is, what if I have wet macular degeneration? Should I still be taking the AREDS2 vitamins? I would tell you yes. The primary reason to take an AREDS2 vitamin is to prevent your AMD from becoming wet. But if you have wet, let's say, in one eye and not in the other, then you should still be taking it. The AREDS2 vitamins have also been shown to help prevent what's called geographic atrophy, another form of advanced AMD. And so even though someone may have said, well, now you have wet, you don't need to keep taking this vitamin, the reality is there's still probably benefit to be had by continuing to take the vitamin. So in general, I would say yes. Once you start taking the AREDS2 vitamin, it's likely something that you should continue to take, whether it's for its effects on wet or on dry/geographic atrophy. Great. All right. So I'm going to stay with a couple more macular degeneration questions, and then there's a couple questions that are different things within eye care. So, there's been some stuff in the news about red light therapies for macular degeneration. And so there's a couple questions about that. So I'll go ahead and cover that. Someone said, I heard there's a new treatment for dry macular degeneration, red light therapy. Can you tell me about it? So actually, maybe 6 weeks ago, a colleague of mine and I did a whole webinar, one of these series, about this new red light therapy. So the fancy medical name for it is photobiomodulation. And the reason I point that out is because the name tells you what it does. So photobiomodulation, using light to change biology. So it's using specific wavelengths of light to change the way that your biology, the cells in your retina, function. And when you do that, it can essentially turn cells on that had already been turned off. Think of it that way. It's turning the lights back on. And so cells are working differently. And with this specific type of therapy that the FDA has cleared, they're able to show that over a 2-year period of time in these patients with dry macular degeneration, vision was improved. So it's not just that it didn't get worse, it actually improved people's vision. And it also helped to decrease the likelihood that they developed what's called geographic atrophy. So lots of positive effects from a specific wavelength of light. So the upside, the cool thing, is it's light. And so nobody was harmed by the light. It's easy to have done. You don't have to take pills. You don't need to get shots. It's looking into an instrument at an eye doctor's office that has this very specific type of light. That's the upside. The downside is that in the study, the way that it was used is people had 3 sessions a week for 3 weeks, 3 times a year. So that's 3 times 3 times 3. That's 27 total treatments over the course of a year to get these really fantastic results. Now, each treatment session only lasts maybe 10 minutes, so they're quick, but there needs to be somebody in your local area that is able, that has the instrument, that is providing the treatment that you're able to get to. So it's super exciting because it is what we would call non-invasive, very easy treatment that can have effects to not just slow, but can actually improve vision. So something that's super, super exciting. It is not very widely out there yet. It's been out for less than a year, but it is something that I would encourage people to maybe look a little bit more into as a really fantastic option. Now, there's a question here. If you buy red light products on Amazon, is that the same as what I just mentioned? What I would tell you is absolutely not even close, not at all. That's like saying, well, gosh, I've got a red light bulb. If I just sit in front of that, will that do the same? No. So with the lights, What's important is the exact wavelength or color of the light, how long you're exposed to the light, how intense or how bright the light is. So there's multiple variables that can be changed. And so what we know from the study that was done is we know the exact wavelengths or color, we know the intensity or brightness, and we know the length of time for which the treatment was applied. And so anything other than that is just assuming, well, it seems like red lights help, let's give it a try, but without any real information to know if it's truly going to be beneficial. So just buying a red light product from Amazon, is it the same? It's not even close. Now, that's not to say that, I don't know if you'll get positive, negative, or no results at all. I can't tell you because there's been no study of those products and they're all very different. So, could that be better than nothing? Maybe. Could it be worse than nothing? Probably not. But my guess is it's going to take something a little more sophisticated than just a red light bulb that you buy on Amazon. Now, the two reasons people may want to go and just get a light on Amazon, I think there's two things. One is ease of use. If you have something in your house that you just flip a switch and turn it on for 10 minutes a day, 20 minutes a day, whatever it is, that's super easy. And so that's attractive. Again, it may not work. And then the other thing is cost. So if you go and buy some sort of red light on Amazon or wherever, it's a one-time cost and it's going to end up over a long period of time being really inexpensive. And this new treatment that's been cleared by the FDA is something that is not being widely covered yet by insurance. I think at some point it will be. I think it will be covered by insurance. But right now, for the most part, it's not. And so it can become a little bit pricey. And the cost is going to depend on where you go and how much they're charging. But again, it's the one thing we know right now that if you have macular degeneration, that on average will improve your vision. So to me, that's something that is super, super exciting. There's another question about that. At what point will red light therapy no longer help macular or glaucoma? I do this at home on my own. So, we really don't know. And so the studies for it in glaucoma are not nearly as robust or as big or well done as what we've seen in macular degeneration. So I don't know. When it comes to macular degeneration, the studies that have been done are in people that have what's called intermediate dry AMD. So it hasn't been done on people with wet AMD. So we don't know what will happen there. But again, I just warn for anyone that's doing it at home, I'm not telling you that it will or won't work, but what's really important to understand is what you're doing at home is dramatically different than what's been done in any clinical trial in a very controlled manner. Things that we buy and do at home, again, the convenience is fantastic, but oftentimes the quality starts to lack. It's not going to be quite the same. So good question. So I'm going to go off the AMD questions for a minute and I can come back to those. Someone asked, can I have an MRI if I have a port implant in my eye? It's a really good question. So let me first touch on the most common type of implant in your eye, and that is after cataract surgery. So if you've had cataract surgery, then you have a lens implant in your eye. And that is probably the most common procedure that there is, period, not just in eye care, like period. It is extremely, extremely common. And there's no problem in someone that's had cataract surgery to have an MRI or any other test done. The reason the questions about MRI is MRIs use really strong magnets to get an image. And if you have any type of implant that has metal, then it could, and it's likely that the magnet will pull the metal and can rip it out of your body. That could be pretty gruesome. So cataract surgery, no problem. If you've had the port implant, it's called Susvimo. You should be able to have an MRI. However, there are some special precautions that should be taken in order for someone to have this done. So the way I would answer that is that most likely the answer is yes, you could have an MRI, but make sure that the person that's doing the MRI knows about Susuvimo, the port in your eye, or any other implant, whether you think they're metal or not. Better to ask than not ask and have something really bad happen. I'm kind of chuckling at this next one. It says, hang on a second. Okay. What's that crazy commercial about? They say something about mites. What are they and are they contagious? Yeah. So there's a company doing a fair amount of commercials right now for a new medication they have. And so the commercial is for medication that gets rid of mites that are along your eyelids and eyelashes. And so these mites are actually super, super common. If you're over 70 years old, 70% of people that are over 70 have these mites. And so it is really, really common. And so interestingly, it's something that historically doctors may not have looked very hard for or made any note about if they did see it because there wasn't a treatment for it. But now there is. There's an eye drop you can use to get rid of these mites. It's one drop twice a day, 6 weeks, done. But again, 70% of people over age 70 have these. They are not contagious. They're not because of anything you did or didn't do. We have these little mites and bacteria and all sorts of other bugs all over our body. And it just so happens that some people have some extras along their eyelids and eyelashes. And oftentimes they can cause the same symptoms as dry eyes. It can make your eyes feel gritty or dry or irritated or red, or sometimes it gives people really swollen eyelids that just always look kind of thick and swollen. And again, this is something that is super, super easy to treat. So I'm glad somebody asked about that. I'm looking for a doctor in my area that does that red light therapy, and I'm unable to find one. How can I find out where a doctor may be located? So the name of the device that does it is called Valeda, Valeda. And so if you Google Valeda and you go to the manufacturer, the company's website, they'll have a find a doctor there. And so you can go to their website and then you can put in a zip code, and then they'll tell you where there's somebody near you to be able to find somebody that does the treatment. So interestingly, that for the webinar that I did not too long ago, I did it with a colleague of mine who's in Washington State. And in his practice, they have the instrument. And he said that they get patients from literally all over the country. They've had patients fly to Seattle from New York because they didn't find somebody in their local area. So if they were going to go somewhere else, they wanted to go somewhere they wanted to go. But again, remember, it's 3 times a week for 3 weeks, 3 times a year. So you'd be having to do a whole lot of traveling if you're going to go somewhere that's really out of town. But that's how you can go. You can go to the company's website, and there'll be something that's called a Valeda locator. And so actually what I may do here, Donna, is just while we're doing this, I may share my screen so that you guys can see this. So I'm on the website for the company that makes it here. And what I'm going to do is I'm going to click on where I am. I'm in the United States, and then I'm a patient. And then up here at the top, I'm going to put Valeda locator. And then it's going to come up. Oop. Sorry, I hit a wrong button. But I'm going to go to Valeda locator. And it's going to come up. Well, maybe I'm not, maybe you guys will figure out how to do this the right way, but this is how it should be able to go. But there it is. So I'm going to put in where I live. So I know that Donna lives, I believe it's Port St. Richie, which is, I'm going to spell it wrong. So I'm going to basically just put Tampa, Florida. And I'm going to say, let's look at within 250 miles. And then you'll see that's going to give me the places within 250 miles of that. And then I could click on those, or I can go over here and look and see who they are. So that's how you'd find out if there's somebody in your local area or who's the closest place to you that is doing that type of treatment. All right. So that's how do I find someone that does that? So someone said, I've been receiving injections and the stuff they use on my eye before the injections burns and continues to improve even when they rinse my eye. Why? What can I do about it? So if you're getting injections, what's one of the things that's really important before you get the injection is to clean your eye and around your eye. So to try to get rid of any bacteria or the mites or any other bugs or anything, the virus, anything that's there, so that to try to do what can be done to prevent getting an infection from the injection. By the way, infections, when you get an injection, are pretty darn rare. And that's part of the reason, because almost always they're putting in some eye drops of something to essentially clean the eye. So the stuff that cleans the eye, it works really good to kill off viruses, bacteria, and all that other stuff. But most people are at least a little, and some people a lot, sensitive to it because it's pretty strong stuff. So what can I do about it? So number one, you can make sure that the doctor knows so that they do a better job of rinsing when the procedure is done. Sometimes doctors may give you artificial tear drops, just like if you had dry eye. They can help soothe and comfort your eye after you have the injection. If it really causes a lot of inflammation, there might be other eye drops to use to kind of counteract that inflammation. But it's a very important step of the injections to try to prevent infections. But it's a good point. For some people, those drops can be really irritating, unfortunately. Someone said, I've heard a lot about gene therapy. Can you tell us about it? Is it available now? So I'll answer the easy part first. Is it available now? No. It's going to be a few more years. But gene therapy is one of those things that when I was kind of giving you my opening statement, I mentioned about things that seem science fiction. And gene therapy is one of those things where it really seems science fiction. So the idea behind gene therapy is, can you change the genetics within cells so that they act differently? And so what's being looked at for both dry macular degeneration, so geographic atrophy, but also for wet macular degeneration, are how can you change how the retinal cells, the cells in the retina and the macula, how can you change what they do, how they perform? And so, for example, can you make it to where in wet macular degeneration that you turn some of the cells in your eye to medicine factories? And the answer, as it turns out, is yes. And so the way this is done is, so I'll try to give you the science in a way that's relatively easy to understand. So what scientists are doing is they're creating viruses that carry a gene to change the way your cells act. Okay, so the idea is to get this virus into some of your retina tissue. It infects the retinal tissue with these genes that basically create medicine factories. So imagine if instead of having to get an injection in your eye every 6 weeks, 8 weeks, 12 weeks, you basically have it done one time. And then you have this medicine factory inside your eye, so you don't need repeated injections. So that's what's being looked at in wet macular degeneration. For geographic atrophy, there's something similar being looked at. There's also medications or gene therapies being looked at that will take the cells that are already either dead or just about dead and making it so that they kind of turn back on and are able to see light again. So there's different versions of gene therapy, but it's not science fiction. It's science nonfiction. It's real. There are clinical trials going underway that for the most part have had positive results. And they look like they're going to be a 1 or 2 time treatment and be done long term. So that's the other thing that's super exciting about it. Not just that they'll work, but if you can have something done once and not need repeated therapy over and over and over again, that would make things a lot easier for everybody. So again, that's something that's pretty cool, being looked at both for wet AMD along with dry AMD. It's important to realize there is a lot of research being done into macular degeneration. And it's for a number of reasons. One, because there's so many people affected by macular degeneration. Another reason that kind of goes along with that is that when you have something that affects a lot of people, if you come up with a treatment for it, then a lot of people might be able to take advantage of that treatment, which means there's a lot of potential for profit. So macular degeneration is something that for drug companies can be really rewarding because of the number of people you help, but also really rewarding because of the number of dollars that you can make. So it's a common condition with lots of clinical trials, lots of people looking into that, and lots of potential. And, going along with that, somebody just asked, how can I find clinical trials and are they worth it? So are they worth it? That's an impossible question to answer. And the reason why it's impossible to answer is because in most trials, they have what's called a placebo, which means people that don't get anything versus the new medication. So if you get a placebo, it's not going to be any different. If you get what's being tested, well, it's possible that it's better than nothing. It's possible that it's the same as nothing. It's possible that it's worse than nothing. But what's really important is without clinical trials, we would never have new drugs. So, I always tell people, this is really important. Clinical trials are really important. I'm going to share my screen for just a second again, because I think this is something that is important for you guys to see and potentially know. So let me show this. So the website I'm on now, you can see what it's called, clinicaltrials.gov. And so this is where you can go to look at what clinical trials are out there. And so if I go here and I look at condition, I'm going to put in macular. There we go, macular degeneration. And let's search. And when I search for macular degeneration, you'll see there are currently over 2,000 studies for macular degeneration. Now, this includes US and abroad, because you'll see here, this is one that's in UAE. So we can filter it further. I'm not going to go through all of that, but you can filter it by, is it something that is currently recruiting? Is it something that is, where is it? What's the age? You can see me kind of scrolling here on the left. All sorts of things that you can narrow it down. So you can look and find in your area, you can make it state specific. Is there a trial for macular degeneration in the state that I live in? So you can look up almost anything as far as, what there might be in clinical trials. Let's turn off the screen share. Okay. So that's just something that I think is an interesting opportunity that I would want you to know about, because without people being in clinical trials, then we don't get new medications. So clinicaltrials.gov. Can you have wet AMD and geographic atrophy at the same time? And if so, how do you treat that condition? Yeah, unfortunately, there are people that have both. Having one does not prevent the other. So for better, for worse, the treatments for them, for dry AMD, for geographic atrophy and wet AMD are different. They're each injections. And so for the geographic atrophy, the injection is every 1 to 2 months. And for wet AMD, the injection is every month to 4 months. And so the way that any retina specialist is going to treat that is going to be a little bit varied. There's not going to be one standard recipe. My guess is that most retina specialists would choose to treat the wet macular degeneration because that is something that can change much more rapidly and have more devastating effects more quickly. To treat that and to then consider, once that's completely stable, to go back and maybe also treat the geographic atrophy. So could they both be treated at the same time? Yes, but likely it'll end up being just the wet macular degeneration that's getting treated. All right, so keep your questions coming. I can see how many of you are there, and I know you haven't all submitted a question yet, but I would encourage you to do so because we're a little bit over halfway done, and I want to make sure that if you have a question, that we get those answered. Are there eye drops that can be used for macular degeneration instead of injections? Boy, if somebody could come up with that, that would be the magic wand. As of right now, no. And it's because of the chemical makeup of those drugs that if we put it on our eye, it doesn't get into our eye and get far enough back and get to the macula. So they have not been shown, there's nothing that's been shown to be effective yet as an eye drop to be able to treat macular degeneration. So not yet, but I would assume, I know that there are companies looking at that. There's companies looking at oral treatments, so pills that you would take. Because wouldn't that be great if your treatment for your wet macular degeneration or your geographic atrophy was a pill that you took? That would be pretty cool. Again, in trials, doesn't exist yet. I was just talking about pills, so things that go in your mouth, and someone says, "Why do tears taste salty?" I guess my first answer would be, why are you tasting your tears? But yeah, tears do taste salty. It's because of their makeup. The tears in your eyes aren't just water. People think of them as being as simple as water, or, well, they're just tears. There's actually thousands of components that make up the tears in your eyes. And so they're very, very complex. But because of that makeup, it ends up tasting a little bit salty. To go along with that, someone just asked, I was told that I have dry eye disease. What is that? What's the treatment? Is it the same as dry macular degeneration? So first, is it the same as dry macular degeneration? No, totally different parts of the eye. Dry eye affects the surface on the front of your eye, and macular degeneration affects the inside of your eye. So two very different parts of your eye, two very, very different conditions. So I mentioned that the tears in our eyes are really complex. And so to try to make this as simple to explain or easy to understand, here's what I'll tell you. With the tears in our eyes, there's a couple things that are really important. One is quality, so that they're the right makeup. I told you they're made up of thousands of different proteins, amino acids, and other things. So number one is quality. Do they have the right constituents, consistencies, everything about it? Is it made right? The second thing is quantity. Do I have enough? So what our eyes need is enough tears that are of the correct consistency and makeup to have the right environment to keep our eyes comfortable. And so dry eyes is when you don't have that, either not enough or not the right consistency. Treatment is usually some sort of eye drops, oftentimes starting with artificial tears. And so the next question is, what tear drop should I buy? And I'll get to that in a minute. So oftentimes treatment starts with artificial tears. Then there are prescription eye drops that many people end up using. There's a prescription nose spray, actually, that's used to treat dry eye. Sometimes doctors will talk about things for your eyelids, like hot compresses or little wipes for your eyelids and eyelashes. There's those things. There's even something called, and I know I'm kind of going way off, but some of you may have heard of this, something called an amniotic membrane. So everyone's heard of a placenta that comes out after a baby is born. It's surrounded with what's called amniotic tissue. And as it turns out, this tissue is extremely healthy and regenerative with its proteins, amino acids, and everything else in it. And so sometimes severe dry eye is treated with a very little thin sheet of this amniotic tissue put on the eye. Again, sounds kind of science fiction-y, but oftentimes is amazing in how well it works. So dry eye disease is actually something that's super complex. It's not as easy as to say your eyes are dry, they need more wetness, go get some drops. So, what do you do about it? Honestly, the best answer is going to be follow the direction of your eye care provider, because the answer is different depending on what your eyes look like. What are your symptoms? What are some of these different pieces of the puzzle? It's not the same thing for everybody. So what teardrop should I buy? Honestly, the best answer for what teardrop should I buy is the ones that someone tells you to get. And hopefully that's a recommendation based on what's going on with your eyes. Now, the reason why what teardrops I get is so important. Number one, there's many, many different kinds. If you go to the store, you'll see that. Number two, a couple of years ago, there was a couple bad actors in this area. There were some drops that came to the US from other countries that had some issues, and there were people that got eye infections. There were people that lost vision. There were people that had to have their eyes taken out. There were people that died because of different eye drops that were contaminated and had problems. So, which eye drop to use is actually a really serious question. And again, I would follow the guidance of your eye care provider. Do you know anything about stem cell help for macular degeneration? Yeah, the most important thing I can tell you is right now there is none. And the reason why that's so important is because if someone today tells you, hey, we have this stem cell treatment for your macular degeneration, you need to turn around and run as far away as fast as you can. It's not real. There are clinical trials. The National Eye Institute has initiated a clinical trial for that. So if someone says it's a clinical trial, then what I would say is, hey, I know this website, clinicaltrials.gov. Is your trial found there? Because if they tell you they have a clinical trial and then you can't find it, again, it's not real. So please be very, very careful with anything stem cells right now, because there's no approved treatment and there are very few clinical trials. So if you want to partake in a clinical trial that's legitimate, that's great. What you don't want to do is get stuck in a clinical trial that's not legitimate and have a catastrophic result. That has happened. So, that's something that I think we have to look forward to in the future. But if I were to guess, I would tell you we're looking at least 5 more years, at least, before there's a stem cell treatment for macular degeneration. All right, let me read this next question. It's a little bit longer. And again, just continue to ask you. If you have questions, please send them in so I can get to them. So this person says, my case is low pressure glaucoma. As of now, it's being treated with the same as high pressure. Years ago, I was told the images of my eyes showed larger than normal cups, thought to be congenital. Nothing done for several years until I changed doctors. Treatment started with latanoprost, which is an eye drop, for many years. And my field of vision gets worse year after year. Am I out of luck? No, I would tell you you're absolutely not out of luck. The fact that you have years of history, what's going on, and there's some change detected, it doesn't mean you're out of luck. It may mean that you need a different treatment. So there are many different eye drops available for glaucoma. So it's not just one. There are laser treatments available for glaucoma, and there are surgeries available for glaucoma. So just because you've tried one drop and it's maybe continued to get a little worse on that drop doesn't mean anything. Doesn't mean anything at all. And whether it's high pressure or low pressure glaucoma, the goal of treatment for what we have today is still the same: lower the pressure. So, you want to change the pressure. So what matters is where did it start, to know, have we changed it? Is it lower than where we started? So no, absolutely, you are not out of luck. You are not out of luck at all. And I actually want to refer to another question that I got. That says, my retina doctor said there's nothing else that can be done. Is that true? Am I out of luck? I'm losing hope. So I would tell you, absolutely, usually not true. If a retina specialist says nothing else can be done, that may mean, well, you've gotten injections or you've had this treatment or that treatment. There's not another medical treatment for you. And sometimes that is true. However, usually there's some sort of low vision device that could help you. Low vision devices are things other than just glasses or contacts that help you to utilize the vision that you have remaining to try to be able to function at the highest level possible. So even if you can't get injections or pills or other medications, low vision is really important. How do you find that? Ask your eye care provider, do you provide low vision services? Most will say no. Then say, okay, can you guide me to somebody that does? And then, there's actually another low vision question. That's what are some different options? So you may have heard about or even seen ads for something called Ray-Ban Meta or Oakley Meta glasses. These don't help you see, but there's cameras in the frames that capture images and can potentially read something to you, tell you what you're looking at, tell you where you are. You can use it like your phone, where, if you ask your phone, hey Siri, what's the temperature? Hey Siri, where am I? The glass
You're in me with KS.
Oh, see, now my computer heard me and just answered me. So you can do that with Meta glasses. There's something called eSight Go, and this is the company that makes this is actually one of our sponsors. It is a super cool device that you put on that looks similar to a pair of glasses, but it has cameras, really powerful digital cameras in it, and screens to project the images from the cameras on screens. And so this actually does help you see. It doesn't read something to you. It doesn't answer your questions. It allows you to utilize the vision that you have at higher magnification to be able to be functional. So really, really neat. If somebody says, hey, magnifiers don't work, I went and bought one at Walmart and it didn't do much for me, that doesn't mean anything. If you haven't been to a low vision provider and tried some of these higher tech devices, then you really haven't tried, or you haven't tried what's most likely to be best for you. They've been talking about eye drops that improve your near vision. Does it work for far vision? Good question. So the FDA recently approved an eye drop that is meant for people that have a difficulty seeing up close because of what's called presbyopia. That means birthdays. Once we all get to be around 40 or so, we start to not see as well up close. And that's when we start to wear bifocals. But there's an eye drop that can essentially help your eyes to see that up close stuff without bifocals. It is not a low vision device. It's not magnifier. It works very differently than magnification. Does it work for far vision? Interestingly, in the studies, 40% of people had actually improved their far vision. Now, is this something that's going to take the place of distance glasses? No. Is it something that if you have low vision because of macular degeneration, it's going to allow you to read again or drive again? No. Because if you have problems from macular degeneration, the way I want you to think of that is like if you have a camera, an old-fashioned camera, it has film in it. And if there's a problem with the film, it doesn't matter how much you focus that camera, you won't get a really good picture. And so by taking these drops, it's another form of focusing. But if you still have bad film, you still won't get a good picture. So there's certainly not a treatment for people with macular degeneration to improve or to take care of that vision. But if you're someone that is always, if you don't need glasses, but you're always putting on glasses for reading or computer, then it is very possible that they could be tremendously helpful for you in that situation. All right. Is there help from anywhere with purchasing low vision reading devices besides Meta AI glasses? I have them, but was looking for a tool that costs a lot and need help with the costs. Yeah, so it's an important question because low vision devices are, if you ask me, all more important. They are important, more expensive than what they could or should be. But I think the reason for that is a lot of times there's a lot of technology and research and development that goes into making these. And so unfortunately, they can be pricey. So sometimes there's local resources like Lions Club or other organizations. What I would do is wherever there is that provider for low vision that you're going to, they should have some idea, hey, are there any local resources that can help with this? And oftentimes there are local resources that can help with things. Is astigmatism factored into macular degeneration or glaucoma status as being advantageous, disadvantageous, or neutral? So, I think that astigmatism is likely one of the most misunderstood words in medicine. If I say to you, you're nearsighted, you say, okay. If I say you're farsighted, you say, okay. If I say you have astigmatism, you're like, oh no, that sounds terrible. But it's the same as nearsighted or farsighted. So I would tell anybody that nearsighted, farsighted, and astigmatism are all siblings. They're all just ways in which your eyes need help through glasses or contacts to be able to see. So the reality is that astigmatism has zero effect ultimately on your vision with macular degeneration, glaucoma, or anything else. I mean, except for if it's extreme cases. I have astigmatism. I have glasses. I see fine. So if you have astigmatism, it is corrected through glasses, contacts, lens implants after cataract surgery, zero effect on macular degeneration. Somebody asked, Halloween's coming and people started wearing those scary contact lenses. Are they safe? Do you need an eye exam to get them? It's kind of a trick question. Are they safe? Probably, if you get them from a reputable source, i.e., eye doctor, that has fit them on you and knows that they're okay for you. So, do you need an eye exam? It sounds biased for me as an eye doctor to say this, but yeah, absolutely. Because contact lenses are medical devices, they fit different people differently. And contact lenses that don't fit right can be very unsafe and create eye infections or other problems that could be really bad news. So yeah, if you have either yourself, kids, grandkids that are wanting to get some of these crazy contacts, it is really important to make sure that that they fit appropriately. So are they safe? The answer is maybe. All right. So just a couple left that I have. So again, I would encourage you, if you have any questions, please do get those in before our time is up. So I know if I need to kind of rapid fire answer questions, I want to be able to do that for you. I was given a grid to check my vision with. However, I think I'm not using it correctly. Is there anything else I should use? Great question. So I pretty rarely give that grid out to my patients because it's normally not used correctly. People either, because you're supposed to do it with one eye at a time, holding it at a certain distance. But if you're with your glasses on, actually, but if you're doing it with both eyes or you're moving it around or you're not doing it correctly, then it's worse than nothing. There's actually a digital device called 4C Home. And I know there's been different things about it on our website, on the Macular Degeneration Association website. It is far more accurate than one of those paper grids. It works way better. And it is paid for by Medicare if you meet certain criteria. So if I have patients that meet those criteria, you better believe that I'm recommending and prescribing the digital device for them because it usually costs the same as the piece of paper, which is zero. And it works it's impossible to even, it's not impossible, but it's hard to state how much better it works than the paper. So someone says, okay, so when the day comes for cataract surgery, is there a choice to not affect my near vision, which is fine, better without glasses? Yeah, absolutely. With cataract surgery, with the lens implants that are put in, it can be calculated so potentially you have great distance vision but need readers, that you have great reading vision but need glasses for far, or that you get what are called multifocal implants that give you pretty darn good vision up close and far away. So, what glasses, if any, you'll wear after cataract surgery is up to you and for you to discuss with your cataract surgeon. But we're at a point in time that with technology, really almost anything is possible. There's even cataract lenses, implant lenses, that can be put into your eye. And if they're off by a little bit, they can be adjusted with this very special type of light so that it guarantees a really good result. Okay. Can I have cataract surgery if I'm being treated for wet AMD with injections? Yep, you can. Just realize that if you're getting treated for wet AMD with injections, if you have wet AMD, that's like a blemish on the film in your camera. And so even the best lens from cataract surgery won't give you vision like you had when you were 20 years old again. It's likely the best option. It can correct your vision really well, but you still have the macular degeneration. Will taking vitamins improve my vision? So the main reason why people, especially with macular degeneration, take vitamins is to try to prevent that macular degeneration from changing from the dry kind to the wet kind. So normally the focus is not to make my vision better. Normally the focus is, can it help prevent my vision from getting worse? Now, that being said, most of the time, the vitamins that are trying to help prevent it from getting worse, they have certain things in it that if you actually measure very closely, they actually will improve your vision a little bit. Now, it's not going to be that you're going to go from, not able to drive to being able to drive and read. It doesn't do that. But if measured very carefully on specific charts, then oftentimes you'll see that your vision is a tiny bit better on an eye chart, or that it's a little bit better for discerning colors, or that it's a little bit better with what's called contrast. So right now, my shirt and my background that are white are very high contrast. So you can see that. Most of you can probably see that really well. My hair being not as dark and having some gray and white is less contrast with the white background. But with the eye vitamins that we take for macular degeneration, oftentimes we can improve that ability to see things that are lower contrast, that aren't as black and white. So yes, the way that I would explain it, if you want to just simple terms, is the eye vitamins that you take for macular degeneration can oftentimes improve the quality of your vision. Even if you don't improve the quantity, even if you're not seeing things that are smaller, the things that you do see, you'll likely see them a little bit more sharply, a little bit better. All right, so this is the last question that's been, two more that have been sent in. A friend told me that she has macular degeneration, glaucoma, and diabetic eye disease. Is that possible? How is that treated? Yeah, it is possible. Any one does not prevent the other. So the good news is if you have wet macular degeneration and if you have bad diabetic eye disease, treatments are the same. The same medicines, the same injections that are used for one are used for the other. So there you're killing two birds with one stone. Glaucoma is generally, as I mentioned before, either treated with eye drops, laser, or surgery, and the treatment for that is different. So it's important to know that having one does not protect you from the others. And it's also important to know if you go to a retina specialist, they may be treating the macular degeneration, the diabetic eye disease, but treating glaucoma is not their normal thing. So you may also continue to see your optometrist or your general ophthalmologist for ongoing care there. Most people that see a retina specialist see at least one other eye doctor. So I have patients, so I'm an optometrist. I have patients that I see routinely and do everything to help them with their glasses, if they get an eye infection, if their eyes are itchy or any of that kind of stuff. They also went to somebody different, to an ophthalmologist for cataract surgery, and then maybe they go to a retina specialist because of their macular degeneration. So it is not uncommon for people to have more than one eye doctor. All right, so last question here. What is geographic atrophy and what are its treatments? So saved a real doozy for last because I do talks for optometrists, and this is sometimes a 30 to 45 minute talk to optometrists. I won't bore you with 30 or 45 minutes of medical stuff. So what is geographic atrophy? So it is an advanced form of macular degeneration where the macula atrophies. So kind of like it's similar but different. If you don't use a muscle for long enough, it atrophies and kind of goes away. Geographic atrophy is where the cells in the macula and that part of the retina just slowly die off, different than wet AMD. So it is something that, unfortunately, we used to think that it was very slow to change, but it actually can be really quick to change. If somebody has geographic atrophy, within about a year and a half, 2/3 of people aren't able to drive anymore. So it can change and affect your central vision rapidly. So that's why it's important to have your eyes checked and for your eye doctor to diagnose this if you have it, because it's something that can be treated. So there are 2 FDA-approved medications that can be used. There are injections done every 1 to 2 months. With those treatments, what they do is they potentially slow its progression. They do not reverse it. They do not improve your vision. They do not stop it from changing. But what they try to do is slow down the change, try to buy you time. So that's different than the treatments for wet AMD. So, different than what you might have thought of for other things. But again, just to realize it is different. Geographic atrophy is different than wet. There are treatments. And if you have that, make sure to ask your eye doctors about it. So Donna, we got a lot of questions today. That was great. So we generally do one of these sessions each year as part of our webinar lineup. So if you liked what we did today, please let Donna know. We want to make sure that we're doing what people want. It seems like every year we change our content a little bit, both for our in-person seminars, but also for the webinars that we do, because our goal is not just to be talking about macular degeneration. That's kind of what we were founded on and what we know we do a lot of and do a great job of. But there's other things that concern you about your eye care, and we want to make sure we're addressing those. So if you have questions, concerns, things you want to hear about, This year we brought in for one of our webinars, we had someone that has a specialized program for walking, for a different way to walk as exercise to help control blood glucose and lose weight. So we have all kinds of different things we do when we find things are interesting. So let us know if you have something that you want to hear about. Donna, what I miss? Anything else?
You missed nothing. Thank you so much, Dr. Gerson, for taking the time and giving us all those wonderful answers. And I'm sure everybody learned something, and I hope everybody was able to get their questions in and answered. I'd like to thank everyone for joining us today and spending this time with us. As Dr. Gerson said, you can always reach out to me. My email is donna@macularhope.org. This program has been videotaped, and it will be up on the website sometime in December, so you can listen to it again. And in case there was some information that you were hoping to get and you didn't quite get to write it all down, it will be up again. Again, please look at our website, www.macularhope.org. A lot of great information, videos from previous programs. And then in March, we will have our 2026 program. Good Lord. Our program lineup, sorry. It just went out. Senior moment, I guess. So I want to
That's
thank
what
you
you're
all
doing
for
great,
taking
Donna.
the time. And Dr. Gerson, again, thank you so much for doing this for us. We do really appreciate it.
My pleasure. It's always fun to do this, and love when people send in questions. And be on the lookout for our in-person programs next year. If we're going to be in a city near you, we'd love to have you. And I guess the last thing that I'll say is tell your friends. Honestly, I think Donna would agree with me. Our biggest disappointment for any time we do a program like this is that we don't have more people. It doesn't matter how many people are on, we'd love to have more, because we hope we're providing some important information and education. And really, one thing that would always make it better is if we could get it spread out wider. So if you have a friend with any macular degeneration concerns, or even other eye care stuff, because we cover other stuff, just not as deeply as AMD, tell them about Macular Degeneration Association. It's super easy to go to the website, start looking things up, and then get involved when we have our, whether it's in person or virtual webinars like this. So thank you for attending, and whatever you can do to let more people know about us.